Dr. Garg, are patients with diabetes at an increased risk for contracting COVID-19?
So far, we have learned that patients with diabetes, they are not at increased risk of contracting COVID-19, but so far we have seen that they are at increased risk of having worse outcomes and serious complications if they do contract COVID-19. Complications like respiratory failure, which requires them to be admitted in the hospital, intubation, and those patients, they are at increased risk of the mortality as well. So if patients, they are well controlled diabetes, the chances of those complications are way less.
Could you compare for us COVID-19 outcomes for patients who have controlled versus uncontrolled diabetes?
So somebody who has uncontrolled diabetes, they are likely to be sicker than other patients who do not have diabetes or have diabetes in good control. The chances of them being not requiring hospitalizations are way more. On the other hand, the patients with a stable and controlled diabetes, they can recover without requiring any hospitalization and any major kind of treatments.
Should a patient with diabetes make a plan for when they might get sick or be diagnosed with COVID-19?
Yes, it's always good to have a plan for the sick days. It's better to be prepared. So first thing is that you should be taking your medications and checking your blood sugar as recommended by your doctor. You should follow, in general, a very healthy lifestyle, eat well and exercise, stay active as much as you can, because those are the big things which affect your diabetes control. You should not be waiting for the last minute to get your medications. And it's always good to have some medications for common symptoms like cold, cough, and fever, which you can easily find over the counter. So always good to have planned for the sick days, and if you have questions, please reach out to your healthcare professional right away.
How much insulin should a patient have on hand in case they do get sick?
So at least 30 days of insulin or their medications and testing supplies they should have handy. And if allowed by your insurance, it's good to have 90-day supplies as well. But they, as I said before, they should not wait last minute, and especially before the weekend to get their medications refilled.
How often should a person with diabetes check their blood sugar?
That would entirely depend upon what they have been told by their doctor. Some patients who are on insulin and are insulin dependent, they should be checking their blood sugar up to 4 times a day. Whereas on the other hand, if they are not on any insulin, just some oral medications, they may be checking just 1 time or 3 times, depending upon what they have been told by their doctor.
When should a diabetic patient check for ketones?
So ketones are usually recommended for patients with type 1 diabetes who are totally, completely insulin dependent. So they should check their ketones if their blood sugar is greater than 240, 250, at least 2 times. And they should check for the ketones. And if they see moderate to large amount of ketones in the urine, they should keep themselves very well hydrated, and they should take their medications if they have been not taking before, and they should contact their endocrinologist or their healthcare doctor right away.
Have you noticed any patterns or a set of symptoms that a diabetic patient might look for to know that they need to get tested for coronavirus?
So definitely you should watch out for the symptoms for COVID-19. COVID-19, as we all know, had wide variety of symptoms. It can present with symptoms of common cold or flu. The most common symptoms that I've heard from the patients is usually it's fever, fatigue, shortness of breath. But I have had patients who have complained of nausea, diarrhea, vomiting, and alteration in the taste. So it's really wide variety of the symptoms. So you should watch out for any unusual symptoms of just not feeling well.
Do you have any recommendations for medications that might treat symptoms of COVID-19?
As such, there are no medications have been proven to treat COVID-19. You just go by the symptomatic management. So if you have cough, you just get the cough medications from over the counter. Again, same thing applies for the fever, cold, runny nose. So there are as such no guidelines or recommendations to treat COVID. If you have mild symptoms, which can be managed as an outpatient at home, you just self-quarantine yourself, you isolate yourself from the rest of the family members, and you just take the medications as needed based on your symptoms. But If your symptoms are out of control and they're getting worse, then you should contact your doctor to get further instructions and recommendations if you need to go to the ER or the hospital.
If a patient becomes ill, do you recommend that they make any changes to their diabetes medication?
Yes. So when you are sick, whether it's a viral infection, COVID-19, or flu, or any bacterial infection, or urinary tract infection, the chances are that your blood sugars are going to fluctuate. You will see high numbers, more so when you are sick. So you may need some changes and adjustment in your insulin regimen. It would be advised that you don't do that yourself if you're not comfortable with. You should call your doctor to get further recommendation, but quite times we have to go up on the insulin dosage when you're sick.
Are there any precautions that a person with diabetes should take during this time?
Well, those precautions are the same for any other patients, but having diabetes, I would definitely ask my patients to be more careful and more vigilant. They should wash their hands very often, and if they are out, they should use hand sanitizer, which has at least 60% of alcohol. The only thing that we have learned has been working for COVID-19 is social distancing and masking. So firstly, avoid going to the crowded places, but if you are going out for any essential work, make sure that you are wearing mask because that's the only thing which has proven to work for COVID-19.